trying to repair, but at the same time it's worsening the issue. If you look very well, you see that, if you see, we call it atherosclerotic plaque or cholesterol. They gather at that site where these structures, where the inner walls have been destroyed. So when they continue to gather there, what happens? The lumen of the blood vessel begin to narrow. And as it narrows, it means that whatever that blood vessel is supposed to supply oxygen or blood nutrient to, that structure, that cell, that organ will receive a lesser amount of oxygen. So when that organ or that cell or that tissue, when he or she receives a lesser amount of nutrients, what happens? It's going to die somehow. And you know, when we age, the elasticity of our blood vessel reduces. It's not like kids that have a very elastic blood vessel. As we age, the elasticity decreases. So our body might not have the same fighting spirit that it has when we're 10 years old or 15 years old. So we'll see. One of the effects of atherosclerosis, you see it, is myocardial infarction or heart attack. Simple heart attack. Now, our heart, just like every other organ, just like every other tissue in the body, needs oxygen to survive, needs nutrient to survive. Now, if you look very well, the blood vessel here, or the coronary artery, this is a blood vessel that supplies the heart oxygen, that supplies the heart nutrients. Now, when it begins to block, what happens? There is less amount of oxygen being supplied to the heart. Now, when this starts to happen, the heart begins to suffer from lack of oxygen. The patient starts feeling chest pain, or angina pectoris, as we call it in medicine. But the patient starts feeling chest pain. Now, it's the first sign when it's completely blocked. That particular region of the heart experiences complete lack of oxygen and lack of nutrients. That part dies. And in a few minutes, the patient enters into cardiac arrest because the heart can no longer function. And in less than 2 or 3 minutes, the patient is fighting for his life. This is what happens when you hear about heart attack. Someone dies of heart attack. Heart attack is just lack of oxygen or lack of nutrients getting to the heart. One of the things that causes it is smoking, because we hinder or we block the transfer of oxygen, of nutrients, or nutrient to the heart. And when this occurs, the heart muscle dies. And when the heart muscle dies, unfortunately, the patient might die. If the patient gets good and quick medical care, the patient might survive. It is an impending. It's very, 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 very serious. Here, you understand it better. I try to make us understand. Look at the atherosclerotic plaque, and you see how it has obstructed. Now look at this region that is red. That is the normal structure that is supposed to receive oxygen from that artery. So, but when that artery is occluded or when it's blocked, that particular region dies, and it can lead to heart attack. Another thing I would like to talk about is stroke. Stroke, they have the same mechanism of action with myocardial infarction. Why? Because our brain also needs oxygen and carbon and nutrients to function properly. So the blood vessel of a smoker is already very weak, and because of the build-up of atherosclerotic plaque, the supply of oxygen to the brain is shortened. The brain is one of the most complicated and one of the most sophisticated organ in the human body. But it is the weakest when it comes to oxygen. It takes the brain of an adult 4 minutes to die if it doesn't have oxygen. 3-4 minutes. That is how fast. For kids, it can take like 7, 8, sometimes 10 minutes. For children. But for an adult, it can take 3-4 minutes. So when there is no oxygen supply to a particular part of the brain, in 3-4 minutes, the patient is going to have stroke. And it's very deadly because he or she can lose a part of his body in terms of function. Now, I want to talk about COPD. COPD is called chronic obstructive pulmonary disease. Now, if you look at this is the bronchi, which I explained earlier, that carries oxygen to the lungs. As you smoke, or as a patient smokes, what happens is that when the cilia cells die, they cannot excrete or they cannot clean up the lungs. Then mucus begin to build. If you look very well, you see excessive mucus. They begin to build inside the lung. And when they continue to build over time, the patient finds it difficult to breathe because the bronchi has narrowed. And with time, those small structures called the alveoli, where the gaseous exchange occurs, with time they destroy. And this is called emphysema. Together, it's called chronic obstructive pulmonary disease. Unfortunately, when a patient is diagnosed with chronic obstructive pulmonary disease, there is no cure. The only thing that can be done for that patient is to improve the quality of life. Medically. I love to use the word medically. Medically, there's no cure. So it's just to improve the quality of life. Because one, the patient can no longer receive oxygen. His lungs can no longer function with oxygen. The 21% that you and I can breathe conveniently is no longer enough for that patient. I have a picture of patients suffering from COPD. We must have seen patients with tubes in their lung, in their nostrils, tubes. These tubes supply oxygen, fresh oxygen, into their nostrils to help them breathe. Some of them carry it in packs, some of them push them in trolleys, and some of them, when it's too critical, they remain in the hospital. So these are patients that has COPD. Another thing I would like to talk about again is fertility disturbances. When we smoke, or when a patient smokes, it affects the production of spermatozoa in the body. There are different structures which I've placed here. That is the normal structure, and these other ones are different shapes and different structure. And the others are not fertile. And this affects especially the men. It's very important. It changes the DNA and changes the structure and the function of spermatozoa. And this affects fertility. Another thing I want to talk about is embryonic deformities. This one may interest our ladies. Now, when a woman is pregnant, and when a pregnant woman smokes, it affects the child or the fetus. Now, this one is very important because it also affects passive smokers. So whether you are active smoker or you're a passive smoker, usually what I do is, if I see someone that is smoking, I go to the other side where the wind is coming from, so I don't have to perceive or to inhale the smoke. It can lead to stillbirth. It can lead to miscarriage. It can lead to what we call placenta previa. where the placenta, normally the placenta is located up here. But in placenta previa, the placenta can come back and block the cervix. Can come down. Instead of the head of the child to be down, the placenta will occupy that position. And in that case, the woman cannot give birth. It has to be CS. It's dangerous because it can also lead to what? Abruption of the placenta from the uterine wall. Normally, the placenta is attached to the mother's uterus. Now, one of the consequences or one of the effects of smoking is detachment. It detaches, and the baby does no longer have communication with the mother. No oxygen, no nutrient, and the child dies in the mother's womb. It's very, very dangerous, and I encourage women here to be a little bit careful when it comes to smoking. And if you have friends, colleagues, who can also help them. After talking about the effects, how does our body heal? How can we stop? How can we quit? How do we change? In as much as there are a lot of negative things about it, how can we improve our lives? One of the first things is to make a decision, is to pray about it. Because it's addictive and it's very, very difficult to stop. Remember to pray about it. Talk to your pastor about it. Because statistics has shown that when people talk about it, their chances of quitting increases. When you decide alone to stop it,